It seems like anxiety and depression are manifesting in our children more and more these days. Today, we're going to talk about how we can diagnose anxiety, depression, and other learning disabilities within the school system and how to access services for your children. Hi, welcome to Health Journeys, a podcast about real human experiences in health and medicine. I am your host and healthcare advocate, Maritza Hasty. Health Journeys is all about discussing the diagnosis and treatments of diseases and exploring personal stories in pursuit of overall health and well-being from different points of view. Support for this podcast comes from Hasty Storytelling. Hasty Storytelling is a creative agency that specializes in production, brand strategy, and live streaming solutions. For more information, visit us at hastystorytelling.com. Hi everyone, welcome to Health Journeys. Many students can exhibit signs of depression, anxiety, and other mental and physical difficulties during their time at school. On today's episode, we have Sharika McKenzie. She's a school psychologist who will share some important information on how to assess these students and how to access services provided by the school system. Hi, Sharika. Welcome to the show.
Hello, Marissa. Pleasure to be here.
So happy to have you on the show. Before we begin, I want to make sure that our audience also knows that you are a licensed marriage and family therapist, and you're also a licensed educational psychologist. Is that correct? Okay. Yeah. I want to make sure that we have all your credentials. So thank you so much for discussing this really important topic. Because what I want is for my listeners to understand solutions and services that are available for their children should they be experiencing some of these issues. But before we get there, can you tell us a little bit about yourself so that my audience knows who Sharika is, your background, and your experience, and how you got to doing what you're doing today?
Okay, so let me see, where do I begin? I want to say that my background in mental health has definitely led me to the career that I'm in now. I've been working just in the field of mental health, I want to say probably for the past 12 years now. I transitioned into working in the career of school psychology, where I'm currently working for a school district here in California. I've been working as a school psychologist for the past 8 years now. So that's definitely, been a while within the field of education. I think the way my path has set me up, I started out as working as a therapist in the field of marital family therapy. And just through my internships and traineeships, it brought me back into the school setting where I was providing therapy services to adolescent students and children, younger children as well. And so I've been working in the field for quite some time now, and just, have an abundance of experience working with children and adolescents of various ages.
Wow. So can you tell us what is the youngest age group that you've worked with? And how does the process go as far as identifying certain signs or symptoms, whether it's anxiety or depression? Can you take us through that process and how it works within the school system?
Within the school system? Mm-hmm. So if I'm specifically focusing on special education, so what I mainly do in my job is to assess students to determine the need for special education services. And so, you can assess children as young as the age of 3 to see if they're eligible for services under certain criteria. And if they meet the eligibility criteria, they can begin to receive services, even if they're not necessarily receiving classroom support at that time. So as I mentioned, as young as 3. And so, the process usually starts with a referral process, and that could come from a doctor referring a child based off of what the parents are saying, or it could come from the parents making a referral as well. Depending on if the child is already in school, the referral could come from the teacher as well. And based off of that referral, we determine if interventions have already taken place, and if the interventions have been successful. Usually this is through a process called, it's the SSP process. Some schools may call it something different, but it's a student study team where we meet as a team and discuss whether or not this child needs to go through interventions before getting assessed, or if we just want to move forward to the assessment process. And based off of that assessment, IEP meeting is held, and during that IEP meeting, it's determined whether or not a child will become eligible for special educational services.
Is the goal to keep the child in the classroom with other students, or how do you deal with that? Or is there a program where the students actually go? Can you kind of maybe tell us a little bit about what happens once a child is identified with special needs?
Usually we do our best to keep the children in the least restrictive environment. So in least restrictive environment is considered general education setting. So just a typical general educational classroom or school setting. And so we always strive to keep the children or adolescent in that setting as much as possible. And based off of whatever needs they have, we determine what goals they may have. And based on the goals they have, we determine what services and supports we need to put into place to support the child in being in the least restricted environment. So it's usually a continuum of services. So if a child's already in the school setting, let's say you have an elementary student, if they're already in general ed and they are eligible for special education services, maybe we will start off with RSP support. If that's not successful, then maybe we'll go into a small classroom setting. If that's not successful, maybe we may need to look at a non-public school or whatnot. So we just kind of go off of a continuum of services.
So in your expertise and your level, it's not necessarily that you are tied to one particular school. So what it sounds like to me is that once there's an assessment, there's even an actual school that can be selected based on that assessment. Did I understand that correctly?
Yeah, we, school psychologists, depending on the district, they can work at one school site or they can work at as many as maybe 3 school sites. It really depends on the need. And so, we do our best to try to keep the child at their home school. So their school of residence, they're within their, where the neighborhood where they're living. We try to keep them at their school. However, if they don't have a program that the child is needing, then we have to look at, okay, does our district have any other schools that may offer that program to support that child?
Okay, this is good information because our listeners could have a child that maybe has some needs and maybe they don't really know what's available out there. So I'm really glad that we're discussing this topic today. I was wondering if I could take you now a little bit more focused and I know there's a lot of different diagnoses, as you said, things can be happening with kids. They could have ADHD and there could be all kinds of things happening. But I wanted to maybe focus on some anxiety issues and depression. And we seem to see a lot of depression and anxiety in younger and younger kids these days. Can you tell us what are the most common contributors that can cause anxiety and depression in young children and middle school and in teens? Maybe kind of take us through some of the factors that could affect these kids.
Yeah, so let's talk about anxiety. So anxiety is actually one of the most common disorders that children tend to experience. This is a disorder that can definitely begin at a young age and continue on to adulthood for individuals. And so anxiety can, you may have a child as young as 6 or 7 displaying symptoms of the anxiety, and that could be, separation anxiety, separation anxiety, social anxiety, PTSD, which is post-traumatic stress disorder, or general anxiety disorder. So, as I mentioned, you can see this manifested in children as young as 6 and 7. And sometimes these children may go unnoticed because these are the internalizers. These are the ones that you may not see them acting out, so they may not stand out like some of the externalizing children that display some of the externalizing behaviors. And so, as I mentioned, usually 1 out of 3 individuals will meet the symptoms for anxiety disorder before the age of 18. Okay, and then also with depression, so that's one of our typical mood disorders, along with dysthymia, bipolar disorder. Those are the typical mood disorders. And depression is usually, we tend to start seeing symptoms of depression within adolescence. So around that time, you may see it younger, which can happen for sure. And sometimes anxiety and depression can go hand in hand, where a child may be experiencing both. And so there could be various reasons that may cause anxiety or depression. It could be, as I mentioned, PTSD, experiencing a traumatic situation for them where they don't know how to handle it and they don't have the coping skills to address how to handle that situation. And it could just be going to school. It could be trying to socialize around others and just not feeling comfortable or confident in themselves. It could be various reasons in children and adolescents for, anxiety and depression.
And what does a typical session, or what does time with you? I realize that right now we're in the pandemic, and so we're actually going to talk about that in a few minutes. But what would a typical, would I call it a session or an assessment? How is that? What does it look like when the student is with you? And let's say a middle school child, maybe they're anxious or depressed, or can you take us through what a session would look like with a child in that age group?
Well, it really just would depend on the child or the student within that age group. Depending on how talkative that individual is as well. Yeah. There may be times when a child doesn't feel comfortable with me just as of yet, and they may not be as talkative, and you just kind of have to go with their pace and not try to force any information out of them. And so it really depends. And so, definitely with working with students with anxiety or depression, you really want to focus on coping skills and building their coping skills. Some of them may think they have solid coping skills, but if they're still kind of feeling the way that they do, maybe the coping skills not working for them. Maybe they need to build upon the coping skills that they have. So sometimes it's just getting them to think about, okay, what can I do to take my mind off of how I'm feeling right now? What can I do to just ease my body? Because with anxiety, you can feel it physically. Whether it's your heart starts pounding, or you start to sweat, or whatever it is, or the thoughts start coming to your head. It's just kind of getting them to really focus on the coping skills, of whether it's like breathing exercises, just imagery, just thinking of a calm, relaxing place as well. So just, it could be various things to focus on. It really, as I mentioned, it really depends on the student.
So now, will you see them through the progression? How often do you set appointments with them, and how often, once a child is, has come to you and you're working with them, how often do they get to see you throughout the school year?
So that is also determined by their IEP, which stands for the Individualized Educational Program. So that's usually, so a child that receives special education, that means they have an IEP in place. Okay, and so based on the IEP determines which services they receive. So let's say if they're receiving counseling services or therapy services with myself, it's really up to the IEP team, and the IEP team typically includes an administrator, a general education teacher, a case carrier, which is typically a special education teacher, and it can also the parents. The parents is definitely a very important member of the team as well, and they have a say of what their child's program should look like, and it all has to come to a team decision. So a child can receive services, whether it's counseling every week, once a week, twice a week, every other week, maybe once a month check-in. So it can really vary based off of the needs. So we really focus on the goals of the child and determine, okay, how many minutes or how much service do we need to put in place so that we can work with the child to attain their goals.
So you mentioned parents being a very integral part, obviously, of this whole process. And we're talking about, specifically anxiety and depression, and one of the topics that's really big in the school system is, pressure and bullying and things of that nature. So I was wondering if you could touch on some of that, and if you've ever had a situation where either you've had the bully or the victim of the bully, and how do we work with that, and how do we get whichever side you want to pick or you have an experience in, how do you help with those measures and how we deal with bullies in school?
Mm-hmm. The sad thing about it is that bullying is just not uncommon, and we can see bullying happen at all levels, elementary level, middle school, and high school level. And the bullying may be verbal or physical bullying or intimidation. And so with addressing bullying, usually depending on the individual and what the need is. So let's say if you're working with the individual that's being bullied, you may just kind of want to focus on how their feelings about it. Have they spoken to anyone? Try to help them become more of a self-advocate, because sometimes in kids who are bullied, they may not want to speak up as much about it because they're afraid if they say something, they may get bullied even more. Yeah. And so it's good to actually just kind of talk to them and build up that confidence in themselves so they can begin to self-advocate for themselves and speak up and let them know how they're feeling about it. And it can be tough, and a lot of people may have experienced some kind of bullying in their life, at some point. And so it's just kind of building that hard skin to realize, okay, they may be saying something about me, but that's not true about me. Having the realization that whatever they say about me, I don't care what they're saying. I know who I am, and I know what I have to offer. And even when working with the individuals who may be the one that's doing the bullying, sometimes we don't even know, if they're being bullied themselves. What's bringing this onto them, how they're home like this. Sometimes individuals project onto others because it's easier to take their frustration on somebody who may not be able to pick on them, as easy as they're being picked on by somebody else.
Yeah, no, it's interesting because we of course we're going to identify usually with the victim, because that's usually where the heart goes and where we feel, the compassion for. But sometimes we actually have to look at the perpetrator and the bully, because something's going on in that child's life that's making them act this way, and what what's going on there. So some really, really good points. I also wanted to talk a little bit about pressure and parental pressure in particular. We know that sometimes even culturally, there is a pressure for kids to be, star athletes, star students. 4.0 is nothing less as, how do you, or have you ever had the opportunity to communicate with parents when you've seen maybe one of the students that has come to you or that has shared that, they're just feeling an immense amount of pressure? Can you maybe take us through what that scenario might look like?
So if the child is on an IEP, let's say if the child's already receiving services, we kind of, as I mentioned, we include the parents in the meetings. Whatever IEP meetings that we have, the parents are always included and invited in those meetings. And, we usually like to be realistic with parents and let them know, if your child if your child's intellect is, let's say, low average, we can't expect them to be obtaining, grades that are above average, or have, put them on the pedestal where you're focusing on them being superior to peers their own age. And so it's just about being realistic with parents and letting them know this is, where your child is capable of learning. They may not get all A's, and that's okay. let's be grateful for what they can get. They're doing their best. If they're trying, we have to, encourage them and praise the child for that. And, if the parents, let's say it comes up in a session, just generally speaking, it's always good to try to maybe bring the parents into the session with the child's permission, of course, and maybe encourage the child to express to the parent how they're feeling and how they're feeling overwhelmed, and just kind of have that open dialogue during session with them.
I think that's a very important point, because I know we're talking specifically about a child that's been assessed that has some special needs, but even just in general, for our listening audience, maybe some parents out there that don't realize what it's like to put these pressures on their kids, and that it can manifest, as you were saying, in anxiety, depression, other disorders, because they just feel like they've got to be, again, the best athlete, the best student. So for our listening audience, I think that's a really valuable point that you brought up about communication, about kids being able to talk to their parents and say, I really feel like you need to help me out here and meet me halfway. So, yeah.
And it's really, for sure, and it's really important to ask the child or the adolescent, they may have the goals of graduating from high school or going to graduate and go to college. And it's really important to ask them, are these your actual goals? Is this what you want to do, or is this coming from what your parents want for you? So it's really good to ask the child if they agree, like if they are about those goals, same goals. And if they're not, then we have to realize that that's okay. We may have something in mind that we want our children to accomplish or achieve, but, as long as they're happy with whatever they're doing and they're achieving whatever goals that we have for themselves, then that should be what really matters the most.
Well, and I think that resonates right there, because I know that, sometimes it varies in culture. It's culturally linked. If you're not a doctor, forget it. If you're not a lawyer, and so those pressures that kids feel are just, it's so astronomical. So I think what you just said right there was just so brilliant, because, really focusing on what is it that you want, what makes you happy, what makes you tick, right? Not what makes the parent. I think parents live vicariously through their kids too. Do you see that? Do you see that more manifested probably in kids of maybe parents that have immigrated to this country, because they're looking for a better opportunity, and so maybe that's a pressure that they're putting on their kids because they obviously want better, right? So do you see that, and have you ever had to deal with any of that interculturally?
I mean, I've seen it kind of both ways from, parents who have immigrated here, and, the child is first generation going to graduate from a school in America. And I've seen it where parents, they're native here and they just want the best for their children. And if their children aren't meeting the expectations, then they may feel a certain kind of way. So I think it really varies depending on the family. Some parents are just happy that their kids are attending school, and that could be a big step, just going to school every day. And the simple fact that their children finish school, that's a plus for them. So I think it really varies depending on the situation.
No, absolutely. But some great pearls of wisdom there that you shared. If we can now switch on to the current situation in COVID-19 and everything that's happening with the pandemic, and now all the kids are at home and it's all virtual school. So tell us, how has that changed your role with the virtual school system, and how do you do your job with respect to these kids that you're helping?
Absolutely. So, with this pandemic, it was definitely something where we had to hit the ground running with. I know a lot of school districts, especially in California, when we were informed that we wouldn't be returning after, maybe a week or two, and then letting us know slowly or quickly actually, that we wouldn't be returning for the rest of the school year, that was something that we had to all digest, and not only us, but our students as well. And so just transitioning to the distance learning, transitioning to online learning has been something where we all had to adjust to. So whether or not it was trying to make sure our students had access to the online learning, because not all children or adolescents have iPads or laptops or know how to, navigate. They don't know how to navigate online and try to get to the right sources that they need to get to. And so that was something we had to take into consideration, make sure we could provide the support somehow and helping our students transition to this online learning. And so, in my role as a psychologist, I still have to provide my services. And with the counseling or the therapy services, I have to transition to, making phone calls, of course, with parent support, scheduling these sessions via phone or Zoom with parent consent as well, trying to hold sessions so that maybe the children can still see me, and even though we're not face to face, they could still, see me and just talk during our sessions and feel comfortable at least with still knowing that they have access to me during this time. And I know a lot of school psychologists are also doing the same thing during this time. And, teachers are, I know they're, shout out to teachers because they're definitely doing their best to make sure they can still educate our children. And we're all just kind of, they say that we are all going through this pandemic together, but we're all experiencing it a little bit differently. So it's just, great to just see and how people are trying to transition and make sure they're able to work with and address whatever needs we have to for our students during this time.
Yeah, it's a real difficult transition for everyone, and everyone is adjusting. And I'm wondering if you've had any conversations with any of the high school students that were supposed to be graduating this year, and missing prom and things like that. I'm curious to hear some feedback and how they're dealing with that whole situation.
It could be tough, especially knowing that this is your last year school, unless you go to college, of course, but this is your senior year. So senior, you expect to go to prom, graduate, have grad night, get your yearbook signed by your friends. And it's unfortunate that they don't necessarily have that experience that so many others have had prior to. And, it's just, as I mentioned, it's just been an adjustment for a lot of, individuals during this time. And, you have some individuals who may not care about missing graduation as much because it was more so they wanted to do it for their parents, walk during the ceremony, or they don't mind missing prom. And then you have some where it's really impacting them. And it's unfortunate that this is just kind of how things are right now. But it's just something where if they're able to talk it out with their parents. I've seen online where some parents are setting up, graduations at home for the students, or through the online, schools are going online to have graduation. And I also seen online where somebody set up a little mini prom for their child, which is awesome. But, I think parents are trying to get a little bit more creative. Districts are becoming more creative as well to, at least give some kind of opportunity or some kind of have these students have some kind of moment where they're just not missing out on everything. They're doing their best.
Oh, absolutely. We should probably take a moment to congratulate all of the graduating students during this show right now.
Absolutely. Congrats, class 2020.
Absolutely. So as we wrap up, we've talked about a lot of different things, a lot of different resources that are available through the school district. You're a huge resource. Tell us a little bit about what you foresee as being the long-term effects on these young kids with the pandemic, and how can parents and teachers help with the transition, and what are your thoughts for the future and how these kids are going to adjust?
So, depending on how soon we get back to how things were prior to this pandemic, that could definitely play a role in just how individuals are going to respond. We may see an increase of mental health symptoms, like with anxiety or depression, because a lot of individuals were, they didn't know how to take what was going on. They were living, they're scared about, okay, I can't go outside. I have to be clean. I have to keep my hands clean all the time. It's just transitioning back, and we'll have to kind of see how things go in regards to long-term effects. I think this is just something new which we're all experiencing in this lifetime for us. So I think we just kind of have to see how things go, but we may see an increase in regards to children and adolescents experiencing mental health symptoms.
I think that's important.
Anxiety or depression.
No, very important point, because I think, as we wrap up, that, parents can maybe at least be a little bit more cognizant and maybe take a, look at the behavior of the child. And if they wanted to access services like yours, a school psychologist or some other services, where can we refer them to, and how can they learn more about the services that the school district provides for these children?
Well, various school districts may have a different process. Typically, if they wanted to get more information and just about like special education services, learn a little bit more about that, they may want to look at the California Department of Education. You could access that website online, or they can look at their. I always want to refer them back to their district or school district and ask and inquire about that. Just keep in mind, especially with special education services, it's usually to determine if a child meets eligibility, where the disability is impacting them, how they're accessing their education or how they're progressing in their education. So that's something to keep in mind, because not all students will qualify for special education services. But if that's the case, then the school district or, they will, whether it's a 504 plan, which maybe the child just may need modifications or accommodations at school, or, whatever the team comes up with. But just keep in mind that, meeting eligibility for special education is not always guaranteed, but to learn more about the services that are offered and the disabilities, I definitely refer them to the California Department of Education website. That might be a good source. Or even just speaking to their school site, asking questions to their teachers, to the school psychologist, if they have concerns about speech, speaking to the speech pathologist, so definitely, refer them back to the school site or district.
Wonderful. Great. So for those of you that are listening out there, if you see that your kids are having trouble, they're struggling, something's going on, please get on your school district website. As Sharika mentions, the CDE website, California Department of Education. There's a lot of resources for you out there. And Sharika, with that, I just want to say thank you so much for your time today, for sharing such valuable information. And for our listeners, I will see you on our next health journey. Thank you so much. Support for this podcast comes from Hasty Storytelling. Hasty Storytelling is a creative agency that specializes in production, brand strategy, and live streaming solutions. For more information, visit us at hastystorytelling.com. Health Journeys is produced by Victoria Bilionis and executive producers Dennis Lovelace and Greg Hasty. Finally, if you're enjoying the show, please subscribe, tell a friend, and visit us at hastystorytelling.com.